Not much more than a tiny handful of life, premature babies with a birth weight of less than 1,500 grams have a difficult start in our world. This increasingly large group of newborns presents special challenges to both neonatology and radiology. Here, the limits of the medically feasible are quickly reached. All the more important are conclusive, reliable diagnostics. In order to achieve accurate results and prevent additional radiation exposure, magnetic resonance imaging is increasingly used in this field.
Ja, die MRT ermöglicht eine
MRI enables especially good imaging of the brains of newborns without any additional radiation exposure. One problem is that very small children do become hypothermic rather quickly when they are not lying in an incubator, so that during an MRI examination, hypothermia often sets in.
Es dann oft dazu kommt, dass die Kinder sehr kalt werden.
The MR Diagnostics Incubator System, Nomag IC, by LMT Medical Technology, facilitates particularly gentle and complication-free MR diagnostics in premature babies and newborns. Nomag IC ensures the uninterrupted supply and continuous monitoring of patients during the entire MRI examination with minimal handling. This most notably includes uncomplicated and quick repositioning directly on the ward, fast and stress-free transport, mains independence of monitoring in all supply systems, including for ventilated patients. The entire system, including trolley, ventilation, and interruption-free power and gas supply, is MR conditional. The patient can consequently be moved all the way to the tomograph.
Das MRT wird jetzt in den letzten Jahren
In recent years, MRI has been used at increasingly earlier stages, including in the diagnostics of premature babies, in order to completely capture any deformities or other pathologies of the brain early on within the scope of an exam, and to also be able to initiate therapeutic schemes in good time.
leiten zu können.
The incubator is placed on the patient table. The special multi-channel coils of the Nomag IC can be used even under the humid and warm environmental conditions in an incubator. They are compatible with various MRI systems and are directly connected to the existing interface. The patient is supplied via the wall connections in the MRI system. The clearly arranged display of the Nomag IC facilitates continuous monitoring. A considerably lower level of sedation than was hitherto customary is required. General anesthesia can even be done without completely. The risk of hypothermia is considerably reduced. The image data obtained are very accurate and largely free from movement artifacts. As usual, they can be diagnosed locally and can subsequently be discussed directly with the neonatologist. In this way, adequate treatment can be initiated especially quickly and early on if required.
Ich denke, dass sich das durchsetzen wird, dass die MRT noch
I think that it will become widely accepted to use MRI at even earlier stages and more extensively in order to identify diseases, particularly in children and premature
in
infants.
diesem Bereich steigen bei uns.
I mainly deal with premature births, and of course it is my hope that more and more premature infants will be able to survive without any damage and go on to enjoy a very good quality of life. Nomag IC meets high neonatologic requirements and leads to significant time savings during the entire course of treatment. The system is suitable for newborns and premature infants up to a body weight of approximately 4,500 grams. Optionally available accessories expand the functionality of the Nomag IC. MR conditional ventilation, integrated monitoring, neonatal body array coil, special trolley for transport in the ambulance. Nomag IC. Be sure it's no magic.